have a seat there. You guys both fit on that chair? Perfect. All right. Today we're going to be working on some brushing technique. Got some really cool dye that I'm going to put on your teeth. And what this is going to tell me is two different things. How long the plaque has been on your teeth, whether it's been there for less than 24 hours or more than 24 hours. Okay, so that's going to help us with teaching you guys how to brush and get in there better if need be. The pink means it's been there less than 24 hours, so that's new, fresh stuff. We're not surprised to see that. It's the blue that we get concerned about. That means it's been there longer than 24 hours. That means it's something you guys are missing. That's an area that we can improve on. Grab your toothbrushes and start brushing. And I'm gonna kind of hover behind you, watch what you're doing, and see if I can give you any good pointers, tips, ideas on how to improve that. Make sure you're angling that toothbrush towards the gum line. So rather than moving it on each tooth, just put the toothbrush on the tooth and let it do its job. Did we get all the pink and purple off?
Yeah.
Okay, so that was all stuff you guys could brush off. That's all stuff that can come off at home. Once that stuff stays on for too long, it hardens and turns to calculus. That's when we have to go in with our instruments and scrape it off your teeth. The more you guys can brush off at home, the less we have to do here. You guys did a great job on your brushing technique. Now we're gonna talk about flossing. So flossing is just as important as brushing, and it's not just to get food out from between your teeth. It's to stir up the bacteria that's in between your teeth, okay? We want you to use what we call the C-wrap method. So you're gonna take your floss, you're gonna pull it nice and tight, you're gonna come in between the teeth, and you're gonna make the letter C on each tooth and wipe up. All right, you guys ready to try it? Anything uncomfortable when you're flossing? Any tender spots? That's another sign that you need to get in there and clean a little bit better. You guys are doing great. Good job.
The reason why we're doing this is that the old model for caring for you wasn't working. Millions of kids have cavities. Millions of adults still have gum disease. So if we teach you how to care for your own health and for your own mouth, you'll have a lifetime of health rather than relying on somebody else to do it for you. So gang, this is what we mean by true prevention. Not waiting until the disease happens or the problems happen and then you come in and we fix it. We're actually stopping the problem happening before it even starts.